Dr Krithika, Consultant Plastic and Reconstructive Surgeon, Koshys Hospital, Bangalore. Today I would like to talk about the types of burns and what you do in case you have a burn at home. So coming to the types of burns, we have 4 degrees of burns. One is superficial burns, which involves only the superficial layer of the skin. That usually happens because of sunburn or when you go to a hot place, that's a superficial burn. Then you have the 2nd degree burn, which involves either superficial layer of the skin and a little deeper. Then the 3rd degree burns are the one which involve the fat. It goes very deep beyond the skin into the fat. 4th degree burn is something which goes up to the bone. So that occurs mainly in electrical burns, high tension burns. So that is very uncommonly seen but very risky to life. So now coming to what you have to do in case you have a burn. So the first aid methods that we would use is, first of all, in case it's a child whose hot water has fallen on them, it's called scald burns. Those are the most common types of burns we see in day to day. Child or adult with hot water, oil, any hot fluid which falls on it. So that forms scald burns. So in that case, first thing is you get that person out of that room so that the remaining water should not cause further burns. Also they come into a safer area. In case it's a big burn, like something with the cylinder blast or a fire catching onto your sari or while doing puja, the diya, or while cooking, either of those reasons, please get the person out of the room or maybe even into an open area so that they're able to breathe better and the smoke is not hindering their breathing process. So once you do that, the second thing that I would like you to do is put the part which is burned, suppose it's a finger or face or anything, under running water for 20 minutes. This has to be room temperature water, not very hot or cold. So room temperature water for 20 minutes, you have to place that part, either it's a hand or any other part. So what that does, it reduces the degree of the burn. It makes it more superficial, so faster healing and easier recovery. In case the person's part, like the entire arm or more part of the body is burnt, which usually occurs in flame burns because of fire, then you put the person under shower for 20 minutes. So that way the entire body cools down and the extent of damage due to the burn will reduce. The next thing that I would like you to do is any constriction, like any finger or band or anything that you're wearing tight, please remove all of those. Even the burnt area, the clothing has to be removed so that there's no restriction for blood supply because of the constriction. And after that, if it's an extensive burn, please apply any clean cloth or dress that you have and get the patient immediately to the hospital. Because in case of an extensive burn, which is usually classified as more than 10% in a child below 17 years of age, and it's more than 15% in an adult, the calculation will be done by us, by the doctors. But if you feel that the area of burn is more, please bring them immediately to the hospital. The rest of because he will require IV fluid resuscitation and an extensive ICU care, which all is available in Koshys Hospital. If the burn is small, then please clean that area. Do not break any of the blisters, because that also has to be done in a sterile environment by a qualified doctor. So just clean the area, put a small dressing and get the patient here. What we don't do in a burns is, please don't prick the blisters, because then you're going to introduce a source of infection for that area. Don't apply turmeric, don't apply toothpaste or any other kind of chemical which will progress the burn and make it get infected. The only proved thing that which does help is honey. Honey is the only thing that can be applied as a homemade which is available, and it is very safe in burns. Thank you.